Hi, I'm Dr. Wallach, and what makes me different is that I have a degree in agriculture. I'm a veterinarian. I have a postdoctoral fellowship in comparative pathology. I've done over 30,000 autopsies, including 454 species of zoo animals and human beings. And I'm a primary care physician as a naturopathic physician since 1982. And I'm here to tell you that you're going to hear something totally different than you've ever heard before when it comes to dealing with all the major degenerative diseases. All the diseases that doctors have told you are genetically transmitted, all of the birth defects you can prevent. You'll be glad you watched this video. What we're going to talk about is how you can protect yourself, how you can protect your family, the people you love, your church mates, your neighbors, and your workmates. This is something we need to do. The medical system has failed us terribly, and by doing simple things, by taking action, you'll be able to do this. Do not just sit here and say, man, that was very entertaining, and do nothing, because then you will not be happy with the outcome. If you take action, you'll be very, very happy with the outcome. Well, high blood pressure is a very common disease. It is not genetically transmitted. It's a simple acquired disease. In most cases, it's caused by a mineral deficiency, and you take the complete set of minerals, all 90 essential nutrients with a complete spectrum of minerals, and in most cases, the blood pressure will begin to drop. And blood pressure is one of those nice things. As your blood pressure drops, you can monitor yourself, keep a log, keep track of your own blood pressure, and as the blood pressure drops, you can wean yourself off your medications. On occasion, if people have what we would call kidney failure, you can also cause high blood pressure because the kidneys will release a hormone called renin, R-E-N-I-N, which drives the blood pressure up, trying to drive more blood through the small blocked blood vessels that result in high blood pressure. So what do we do for high blood pressure? We like to give the 90 essential nutrients, 60 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids. And in case there's a circulation problem contributing to this, I like to throw in the ultimate daily tablets, and this will support and promote healthy blood flow through obstructed arteries and also support healthy blood pressure. Don't forget to give up the inflammatory foods, fried foods, processed meats, things like deli slices, sandwich meats, sausage, ham, bacon, bologna. You have to give up gluten and oils. No olive oil, no coconut oil, no margarine, mayonnaise, salad dressings, cooking oils. Arthritis is a very common degenerative disease. It is certainly not genetically transmitted in any way, shape, or form. I'd say 90% of arthritis begins as osteopenia, osteoporosis, osteoarthritis, degenerative arthritis, and really gets bad when you get to the bone-to-bone arthritis point. There is a secondary type of arthritis called rheumatoid arthritis, which is an infection with a bug called mycoplasma. You can cure rheumatoid arthritis in 2 weeks with an antibiotic called minocycline. Kills the bug very quickly, and then you do have the residual damage. And the residual damage of rheumatoid arthritis and the other forms of degenerative arthritis, I like to use the Healthy Bone and Joint Pack, all 90 essential nutrients, 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids. There's a special emphasis on what we call glucogel as part of the Healthy Bone and Joint Pack. And for an average adult, I like 15 a day, 5 at breakfast, lunch, and dinner. And that's designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. Diabetes is a very interesting degenerative disease of the blood sugar system. It has nothing to do with genetics. It is not genetically transmitted. We've known for 70 years that it's a simple mineral deficiency disease. And regardless of age, type 2 diabetes, which makes up 98% of the diabetic population, I would get them on all 90 essential nutrients, 60 essential minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, and throw in what we call the secret sauce, Sweeties, and it has the minerals that are missing when you have type 2 diabetes. You take the supplement program, 1 per 100 pounds per body weight, 1 bottle per month per 100 pounds of body weight. That's 3 a day per 100 pounds of body weight. And you take your fasting blood sugar each morning before you medicate yourself, and as your blood sugar drops, you reduce your medication as you've been taught to do by your doctor. When your blood sugar gets below 100 without medication for a week in a row, you're able to just drop back to where you're taking a fasting blood sugar once or twice a week to kind of keep tabs on it. but it is not a genetically transmitted disease, easily remedied. Obesity is not a genetically transmitted disease. It is certainly not lack of exercise or eating too much. It's actually a simple mineral deficiency. You take the 90 essential nutrients, 60 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, and we like to throw in an accelerator we call ASAP, 1 dropper full under your tongue 30 minutes before each meal. If you need to lose more than 50 pounds, I would actually have you take dropper full under your tongue 30 minutes before each meal and a second dropper full under your tongue 15 minutes before each meal, and you'll begin to lose up to half a pound to 2 pounds a day. This is a simple mineral deficiency disease. Has nothing to do with exercise, has nothing to do with eating too much. Eating too much is a symptom of these mineral deficiencies. Well, infertility is a very simple problem. I've gotten more women pregnant than Solomon. Okay, it's a very simple disease. This almost always involves gluten intolerance, so that the mother cannot absorb nutrients. It requires an enormous amount of nutrients, just like going through puberty. To get pregnant and have a good pregnancy, you need to have all 90 essential nutrients, 60 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, and a gluten-free diet. Maximize nutrition. One of the things you have to be concerned with are women who get pregnant and then have miscarriages early on and even in middle pregnancy. This is not infertility because a woman can get pregnant, but they do have a gluten intolerance and can't maintain the pregnancy because they cannot absorb nutrients. It's imperative that all women who have an infertility problem or have a miscarriage problem must be on a gluten-free diet. ADD, ADHD are certainly not caused by vaccinations. You can throw in autism into the mix here. ADD, ADHD, and autism are all nutritional deficiencies, sometimes of the embryo. The embryo can be born as a little human being with autism and ADD and ADHD to varying degrees, including some variations on fetal alcohol syndrome, fetal drug syndrome, and so forth. It could be pharmaceuticals, prescription drugs, as well as street drugs. And then, of course, there are babies that are born perfectly normal, but then acquire ADD and ADHD and autism because of malnutrition. A big thing you have to appreciate is that our baby formulas, including Gerber's and Enfamil and Similac, have less than 20% of the nutrients that are necessary for a healthy growing person. And we have to supplement these babies before they're conceived, all through the pregnancy they're developed in, from the moment they're born. You cannot depend solely on commercial formulas or natural foods. There's a whole battery of diseases that afflict the brain. We're talking about depression, manic depression, bipolar disease, schizophrenia. And these diseases are all what a psychologist or psychiatrist would call, they would call them chemical imbalances. They would call them chemical imbalances. And of course they are chemical imbalances, not Prozac imbalances, but mineral imbalances. So the first thing I like to do for people with these types of emotional problems, that would include anxiety attacks and panic attacks. They have to get off of all sugar, all alcohol, absolutely no fried foods, no processed meats, no oils, no margarines, mayonnaise, salad dressing, cooking oils, absolutely no gluten, no wheat, barley, or oats. And then they must take the 90 essential nutrients. We're talking 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, and make sure that they have healthy protein and fats with every meal. I like them to eat eggs every day. The biggest cause of low energy and fatigue is just lack of nutrition. That old adage, you are what you eat, is absolutely positively not true. You're not what you eat, you are what you absorb. And so when people have chronic fatigue syndrome, they have what people call candidiasis, low energy, just really not with it. I like them to get them on a gluten-free diet, no wheat, barley, rye, and oats, no fried foods, no processed meats with nitrates and nitrites, no oils. And then I put them on the 90 essential nutrients. I like the Healthy Heart and Brain Pack for people with these emotional problems. Throw in the de-stress capsules, 3 of those twice a day per 100 pounds of body weight, and things look rosy. Sleep disorders are a mix of problems. Insomnia is actually due to mineral deficiencies. You take all 90 essential nutrients, 60 minerals. You take 60 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, and sleep comes easy. You can take an ounce of our liquid OsteoFX Plus before bedtime and ensure a good night's sleep. Sleep apnea is a normal procedure. Look at a newborn baby. They have sleep apnea. You look at a dog's sleep. You look at an elephant's sleep. You look at a giraffe's sleep. Every vertebrate has sleep apnea. It's an absolutely normal behavior. Medical system, for financial purposes, has turned this into a disease with CPAP machines and surgeries. It's absolutely criminal. There is no such thing as people dying of sleep apnea or snoring. The only time you're going to die from snoring and sleep apnea is when your sleep partner shoots you. Skin problems are always nutritional deficiency diseases. Obviously, there's certain infections, but 99% of the time, things that don't respond to medical approaches are nutritional deficiencies. And invariably, they're secondary nutritional deficiencies, meaning the person has usually gluten intolerance. They can't have wheat, barley, rye, and oats. If they do eat wheat, barley, and rye, and oats, they get a contact enteritis, and this causes their intestines inflame. Some doctors will call it leaky gut syndrome, celiac disease, appendicitis, diverticulitis, irritable bowel syndrome, inflammatory bowel disease. We're talking about things like Crohn's disease. All of these are due to gluten intolerance. Well, at that point, you cannot absorb nutrients, particularly the omega-3 essential fatty acids, which results in asthma, as well as things like dermatitis, eczema, psoriasis, rosacea on the face, and your intestines look like your skin does. And you have to get off of gluten, all 90 essential nutrients. You have to take the 60 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids. I would take extra of the omega-3 essential fatty acids, the EFA pluses, take 3 of those twice a day per 100 pounds of body weight. And eczema and asthma, dermatitis and asthma, psoriasis and asthma, rosacea and asthma usually go away in anywhere from 3 to 4 months. Cancer is a self-inflicted disease. It is not genetic in any way, shape, or form. It's self-inflicted from the time before you're conceived, all through the pregnancy you're developed in, from the moment you're born. It's caused by a combination of free radicals and lack of protection. By lack of protection, I mean lack of bioflavonoids, lack of antioxidants to protect you from free radical damage, trans fatty acids, heterocyclic amines, and acrylamides. If you want to avoid cancer, you must avoid fried foods, processed meats with nitrates and nitrites. You must give up oils, including olive oil. You must give up coconut oil. You must give up margarine, mayonnaise, salad dressings, cooking oils. And if you eat canned fish, you got to be packed in water, mustard, tomato sauce, not oils. No gluten, no wheat, barley, rye, and oats. In addition to taking the 90 essential nutrients appropriate for your body weight, 60 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, I would like to throw in high levels of antioxidants. We have some great ones of Cell Shield RTQ, R for resveratrol, T for turmeric, Q for quercetin. And then I also like the Immortalium. This is built on the Nobel Prize winning information of 2009, and it actually helps maintain the life and the health and the stability of the telomeres, which are the end caps in the chromosomes. You do not want to leave home without it. Birth defects are a very worrisome, totally preventable set of events. Birth defects are actually caused by malnutrition of the embryo. There's not a single, now hear me, there's not a single genetically transmitted birth defect. That's all been a big myth. That was running down the wrong rat hole, okay? And it's all caused by, all birth defects are caused by malnutrition of the embryo. And you can't name me a birth defect that's caused by genetically transmitted disease. Now, doctors say that, but it's absolutely not true. And so it's the responsibility of the OBGYN, it's the responsibility of the grandmother, the mother, to be, long before she misses her first 2 periods, to take all 90 essential nutrients to protect the embryo. Remember, you are not what you eat, you are what you absorb, so you have to maximize absorption. No gluten, no wheat, barley, rye, and oats. Take the 90 essential nutrients, 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, and you'll be able to reduce the risk of birth defects to almost zero, even if the whole family's been full of them forever. And that's because when people get generational diseases like diabetes or cleft palate or Down syndrome, It is not genetically transmitted. It's because the mother cannot absorb nutrients because she has a gluten intolerance, or they live in a place in which these nutrients exist in very low amounts. Alzheimer's disease is a physician-caused disease. It did not exist 43 years ago. Today it's the number 4 killer of adults over the age of 65. It's a simple nutritional deficiency disease. A big study done by Johns Hopkins came out in 2004, showed that they could actually prevent Alzheimer's disease in a controlled, double-blind, randomized study on 5,000 people over a 10-year period with a special diet, restricting certain foods and supplementing with nutrients, right? And in February of 2012, the FDA came out and said, give up statin drugs, because statin drugs, the drugs that lower cholesterol, actually increase your risk of Alzheimer's disease and type 2 diabetes. Do not take statin drugs. Well, that's because when you have Alzheimer's disease, your brain loses the myelin, which is the insulation material, and myelin is 100% cholesterol. There are 4 other dementias: vascular dementia, Korsakoff syndrome, Mordecai-Korsakoff syndrome, and Alzheimer's disease. And Alzheimer's disease, also there is the dementia that's caused by a vitamin B12 deficiency. Goes along with pernicious anemia. So, all 90 essential nutrients: 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, 6 eggs a day per 100 pounds of body weight, poached. Also, I would throw in the de-stress capsules, 3 of those 3 times a day. When a person has dementia, I take that many just to prevent dementia. Cardiovascular disease is not genetically transmitted. Certainly it's one of those diseases that are self-inflicted. It's caused by free radical damage to the heart. It has nothing to do with cholesterol. There's no heart disease that has anything to do with cholesterol. Clogged arteries is not due to cholesterol. Stroke is not due to cholesterol. Cholesterol has nothing to do with cardiovascular disease, nothing. So what causes cardiovascular disease? Well, congestive heart failure is a deficiency of a single vitamin. We've known that since the 1700s. And then there's cardiomyopathy heart disease, which causes sudden death in athletes and people who do heavy physical work. People say, he just dropped dead of a heart attack. Well, that's cardiomyopathy heart disease is due to a deficiency of a single mineral, selenium. I've actually done 1,700 autopsies on kids under the age of 10 in Qishan, China, that actually died of that disease. Very familiar with it. And then, of course, there is coronary thrombosis, which is caused by an omega-3 essential fatty acid deficiency, or a ratio problem between omega-3s, 6s, and 9s. And then there's obstructive artery disease, which is due to inflammatory foods, fried foods, processed meats, oils, and gluten. Got to stay away from all the bad stuff. And of course, you want to protect yourself. You take the 90 essential nutrients. I like the healthy heart and brain pack for this one: 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, 1 healthy heart and brain pack per 100 pounds of body weight. I also like to throw in the extra de-stress capsules, 3 of those twice a day per 100 pounds of body weight, and you're home free. Low libido in both males and females is a big problem, and this is due to lack of nutrition. 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, and of course, we need to keep the cardiovascular system available and open. We need to, for both males and females, and we have to get the hormones going. So I like to have 6 to 8 eggs per 100 pounds of body weight each day for both males and females, because testosterone, estrogen, progesterone are all steroid hormones. 95% of the weight of these hormones are cholesterol. You cannot be on a low cholesterol diet. You cannot be on a cholesterol-lowering drugs and have a good sex life. Low T and erectile dysfunction, menopause is all due to a cholesterol deficiency, a physician-inflicted problem. Okay? I like to come up with, of course, in the old days we used to call it the stud horse formula and the filly pack. Today we have what we call the healthy heart and brain pack, 1 per 100 pounds of body weight. It's going to give the testicles, the ovaries, everything they need to make the hormones they need to make. In addition to that, for males, I like to use the selenium, extra selenium. I also like to use extra Prostate FX and throw in GTO, not the car, but Get Turned On. Great, great drink. And then for females, I like to use the Woman's FX, a 150-year-old herbal blend called Woman's FX, the liquid form, 1 ounce twice a day per 100 pounds of body weight. If they prefer capsules, Balance FX, 3 twice a day per 100 pounds of body weight. Get Turned On. And what we shared with you today is the way to add 25 to 50 healthy years to your life. You have to take the action to make it happen. This is something that is doable. There is over $100 billion worth of research involved in the statements that have been given here today. Only you, though, can make it happen. You have to take it and use it. We can save America together, but we're going to have to do it together because the medical system has failed us terribly. Only dead doctors don't lie.